of people travel abroad for medical treatment, from dental work to major heart surgery, all done at a fraction of the cost back home. Medical tourism brings in billions of dollars a year worldwide. So we wanted to know, what exactly is medical tourism? Well, since the mid-20th century, healthcare costs have exploded in many developed countries, especially in the United States. Some have blamed this on the closed system of procedure and drug pricing, which does not allow for free market competition. So when prices rise, they don't go back down. Other factors like exaggerated insurance billing, malpractice lawsuits, and infrequent but serious doctor visits contribute to increasing costs. According to a 2011 OECD report, a procedure like a heart bypass can cost more than $100,000 in the US. However, that same procedure could run less than $4,000 in Mexico. For those without health insurance or high deductibles, medical tourism represents a viable and beneficial alternative. For Americans, the most common medical tourism destinations include Thailand, India, Mexico, and Cuba. In many of these developing countries, medical tourism represents a lucrative and growing source of economic revenue. Countries are actually competing for medical tourists. In Japan, the government is instituting new policies that will help increase the number of hospitals accepting foreign patients. Worldwide, the industry is said to be worth up to $55 billion. However, there are certain drawbacks. The US Center for Disease Control has registered several safety concerns over higher rates of bacterial infections and diseases for medical tourists. These can be attributed to less strict sanitation rules in other countries and the presence of contagious diseases that are otherwise rare in the US. In 2014, 19 American women who traveled to the Dominican Republic for plastic surgery contracted bacterial infections. Additionally, transplant tourism has become a highly controversial issue. Medical tourists can obtain organs and transplant operations without waiting in a long line and for less money. But the World Health Organization says that the organs often come from vulnerable people. Most of the world has completely banned transplant tourism. However, organs can still be purchased on the black market. Medical tourism also presents problems for locals who now face more competition for healthcare in their own country. Wealthy outsiders can crowd out native citizens and even raise the prices for certain procedures by increasing demand. Healthcare providers too can be required to change their practices in order to accommodate and cater to foreigners. A recent report on healthcare in developed countries ranked the US last in effectiveness and efficiency. This is despite the fact that the US spends more money on healthcare per person than any other country. Presently, the future of medical tourism is expected to remain profitable as experts predict billions of dollars in revenue growth for the coming years. Another unusual type of tourism is birth tourism. To learn more about this controversial practice, watch this video.
The law allowing citizenship by birth didn't exist prior to the passing of the 14th Amendment in 1868. It was passed as a way to guarantee citizenship to African Americans and their children. This was done in the wake of the Civil War and the abolition of slavery.
Dr. Claudette Lejam is an orthopedic surgeon at NYU Langone Medical Center here in New York. Good morning.
Good morning, and thanks for having me on.
You are an orthopedic surgeon, a medical professional, and yet you say you find very few benefits in medical tourism. Why?
Well, you know, there are benefits in terms of cost, but you take an additional risk by going somewhere where you're not sure of the quality that you're getting, and you're not sure of the accreditation of both the physicians and the institution, and you're also taking a risk. So if something goes wrong, then what do you do?
But why is it so much cheaper there?
Well, there are a lot of reasons. I mean, obviously, first of all, we have a very aggressive legal system here in this country, so liability is a tremendous cost in any medical setting, so you have to factor that in. Labor is a lot cheaper in other settings. I mean, for instance, an example, a lot of our call centers are being exported to other countries because labor is so much cheaper. So, you know, the same applies here. And, you know, perhaps the implants are cheaper, but, you know, we don't know, you know, what they are.
How do you find out, though, if a better question, are there some things that are good for medical tourism and some things that are not? Like heart transplants, I'd have some reservation. On the other hand, if it was cosmetic surgery, you might have less reservation.
Well, there's risks to any surgery, and that's the point that you have to drive home. Even cosmetic surgery, as we learned from some famous people's parents having died from cosmetic surgery, have risks. You can have infections and other problems after even a small surgery. So you really have to weigh that against the benefit of saving some money.
But then are you saying never use medical treatments overseas?
Well, I can't say that. I mean, obviously some people are going to do it and some people do very well. But when you think about the risk, even if they're small, the consequences are very large. For instance, I do joint replacement. So if a joint replacement goes well, then it's great.
But,
however,
but back to Charlie's question, I thought that was a good one in terms of if you were going to do it, for instance, what would you do and what would you not do overseas? I know any surgery has risk. I get that.
Or would you do it under any circumstances? You,
Yes.
a medical professional.
personally, unless I knew personally the physician and I knew the accreditation of the physician, no, I would
So there's
not.
the
I don't know.
And I
The,
would
the
say-
scene with the guy who's just sort of standing outside the waiting room saying, "What did you think? What did you think?" doesn't seem the best way to get a recommendation.
No, and
So, how was it? Was somebody, I don't know you,
Look
and
at
I don't
my
know the
teeth, they look
doctor.
great, exactly.
Yeah. So if somebody was thinking about doing it, what would be your top recommendation?
well, you need to research the facility, you need to research the physicians, and you need to be able to figure out whether they have accreditation. A lot of these physicians say they were trained in the United States. That might mean they came for 1 month and did an observership, and they can still say they did that. So you really need to be careful about who you're trusting with your medical care.
Thank you.
Thank you, Doctor.
Thank you very much.
Placid Way, your global medical tourism. Greece. Who didn't hear about Greece's warm hospitality and flawless touristic services? Not to mention the wealth of cultural and natural environments praised by so many people. There is an average of 16 million people enjoying the country attractions every year. But did you know that Greece, among travelers' hotspots, is also recognized for its top-notch healthcare system? It's the birthplace of medicine and the cradle of modern civilization, after all. The country features world-class hospitals, clinics, and dedicated specialist doctors trained in the most reputable medical centers on the globe. The Greek medical services are ranked as ones of the highest worldwide. And still, according to the World Health Organization, costs for healthcare remain among the lowest in the world. Placid Way is affiliated with the best hospitals and clinics in the Greek healthcare industry, so that patients receive comprehensive and customized solutions from top specialists. Discover all these medical facilities and enjoy an unforgettable experience filled up with fascinating landscapes and culture. Placid Way opens the door to a variety of customizable alternatives available on the ancient land. Contact us now.
omnymi, Apollona iatron, kai askule pion, kai hygeian, kai panakeian, kai theus pantaste kai pasas, historas poieumenus, epitelea poiesin, katadynamin kai krisinämän, horkon tonde, kai xyngraphän tände.